आजम साहब आवाज आ रही है आपको?
जी आ रही है, आ रही है, आ रही है, आ रही है। प्रोफेसर सलमा कुंदी आ रही है।
I can't hear. I can't hear anyone.
आपकी आवाज आ रही है मैडम? आपकी आवाज आ रही है? We are starting today's seminar. I will request Professor Rashid Saab to recite the Holy Quran to start this program. Professor Rashid Saab.
All right, sir. सर ये सूरह राद है, 13वीं सूरत है, उसकी चौथी आयत है, जहाँ इंसान की अक्ल के हवाले से कुरान मजीद में कई जगह अक्ल का हवाला है। मैं उसकी तिलावत कर देता हूँ। औज़ु बिल्लाहि मिनश शैतानिर रजीम। बिस्मिल्लाहिर रहमानिर रहीम। वफ़िल अर्द क़ितम मुतजाविरातुम व जन्नातुम मिन अनाबिन व ज़र्उन व नख़ीलुन सिनवानुन व ग़ैरु सिनवानी युस्क़ा बिमाइन वाहिद व नुफ़द्दिलु बअदहा अला बअदिन फ़िल उक़ुल इन्ना फ़ी ज़ालिका लआयातिन लिक़ौमिन यअक़िलून। तर्जुमा। शुरू अल्लाह के नाम से जो निहायत मेहरबान निहायत रहम वाला है। और ज़मीन में मुख्तलिफ किते हैं जो पास पास वाक़े हुए हैं, और अंगूर के बाग और खेतियाँ और खजूर के दरख्त हैं, जिनमें से कुछ दोहरे तने वाले हैं और कुछ अकेले तने वाले। सब एक ही पानी से सैराब होते हैं, और हम उनमें से किसी को जायके में दूसरे पर फोकियत दे देते हैं। यकीनन इन सब बातों में उन लोगों के लिए निशानियां हैं जो अकल से काम लें। सदक़ल्लाहुल अज़ीम।
जज़ाकल्लाह।
Bismillahirrahmanirrahim. Alhamdulillahi Rabbil Alameen. I'm going to start with the name of Allah today, and I'm going to
Jazakallah, Professor Rashid Saab. Now it is my honor and pleasure to introduce Professor Sarwat. I have also already shared the introduction of Professor Sarwat Hussain, our great brother, big brother. Sir, thank you very much. You are always very kind to us. And I think without wasting any time, I would like to start this topic. Today's over to you, Professor Sarwat Saab.
Thank you very much indeed. It's a great honor and pleasure to be amongst such eminent professors and scholars. And I like to recognize Dr. Mulazim Hussain and Professor Nasir Zaidi and Khurshid Sahab and all other people who are the office bearers of the Pakistan Radiological Society. And I'm grateful to people who have had me become part of the Radiological Society WhatsApp group. Thank you. So today we're going to talk about artificial intelligence. And this is my promise today, is that I will introduce basics of artificial intelligence and hope that everyone will be stimulated to learn more about artificial intelligence. And I'll give you some pointers as to where to begin. And continue to read and continue to learn and watch YouTube videos, because artificial intelligence is changing so fast that it is almost unimaginable. The lecture that I prepared a few months ago is already was already out of date when I was told that Professor Mulazim requested me for this, ordered me to this lecture. I went and reviewed my lecture and found that half of it was already obsolete. And so we had to renew it. And hopefully you will be informed with these today. Allah subhanahu wa ta'ala reveals his wisdom and his knowledge continuously to the human beings. And he reveals it to those people who seek, who make struggle, who study hard in order to achieve more knowledge. And remember that this bestowing of knowledge from Allah subhanahu wa ta'ala does not depend upon whether you are Muslim or Mu'min. Yeah, this is for Anas, for everyone, anyone who can struggle and seek knowledge, he reveals it to them. And I believe very strongly that artificial intelligence is that subject that has been revealed to those who have struggled and who have taught themselves new things through research. And remember, research is production of new knowledge and self-learning, which comes after you have learned from the books and your teachers. And the purpose of education is for you to be able to teach yourself continuously to improve yourself. And hopefully by the end of this lecture, you might be stimulated to get increase your knowledge by self-knowledge or the research. So today, let's see if I can advance this slide. Okay, so in 2016, there was a radiology professor of radiology, Hinton, who actually prophesied that it is quite obvious that we should stop training radiologists because artificial intelligence is going to take over work. And he was more wrong than anyone has been in the history, because the artificial intelligence actually has increased the work of, increased the need for radiologists, and I will show you in a minute how and why. So after this statement, all radiologists and physicians became insecure in their job to see whether they should go to medical college. Students should go to medical college to become the doctors, and AI taking over them over a period of time. But that insecurity was unfounded. However, it is important to know that will AI replace physicians? Physicians means all the doctors, including radiologists, but it is now widely understood, and this is a stimulation for everyone present here, that artificial intelligence will not replace physicians, but physicians who use artificial intelligence will replace those who do not use artificial intelligence. And the example of this is really the computer science. We now, the physicians, use computers through part of our work. And you know that in many societies, and even in Pakistan, if you cannot operate a computer, you cannot practice any significant amount of practice, especially in the Western world, where many of us get training. Even any part of the world, without computer, you will. So therefore, physicians who use computer, and similarly, those who use artificial intelligence, are going to replace who do not. So the role of artificial intelligence is really supportive, that artificial intelligence increases your height, speed, vision as a physician, as an engineer, or anyone in the society, whether it is a business, whether it is even military, increases artificial intelligence, increases their capability. So just before we go into the basis, I would just want to tell you the latest and the greatest thing, artificial intelligence, is the Chat GTP. Chat GTP was introduced by OpenAI, a company in California. And this is introduced in November 2022. You must please go and write this down. You must go and look at the YouTube tutorial, YouTube videos, then read up about GTP chat or chat GTP in order to learn where we have reached, and as I will tell you, where we actually started from, the latest and the greatest. So what are the components of artificial intelligence? The components, it is not just one body of knowledge or science. It is a combination of a very large number of body of knowledge, which is mathematics, statistics, all the statistical methods, particularly to do with probability and decision-making theories and various other advanced mathematical, the whole of mathematics, the whole body of mathematics is involved in artificial intelligence. Similarly, computing power, ability to compute or ability to solve sums, या सवाल निकालते हैं जैसे हम सवाल लगाते हैं, all that is called the computing power. And then software engineering, in order to enable the computer to create a great power of computing. Then there are programming language. Programming language basically is just like we speak to each other to make each other understand. Similarly, the computers can speak to each other or communicate with each other. They don't speak, but they communicate with each other and communicate with the algorithm in order to make the algorithm, the computer carry out the commands of the algorithm. And then the administration and coordination of all this put together led to the artificial intelligence. So there are human intelligence, there are huge number, 200 or more definition of human intelligence. And you, all the audience are intelligent enough to understand what it means. While the human intelligence, in short, produces learning, it perceives things or understands things or cognitive ability, and it knows things. It has a body of knowledge that is available to be reproduced at command. But the artificial intelligence also refers when the machine begins to behave or mimic human intelligence. Remember that human intelligence is still far, far superior than artificial intelligence, and it is estimated that the current capability or current general intelligence of the latest artificial intelligence machines are equal to about a 6th grader or 10, 12-year-old child. It is far, far away from all the intelligence of all the professors and audience and doctors that are present in this lecture. However, perceiving, learning, understanding, and problem solving are some of the things that artificial intelligence can produce. The very important point to remember is that artificial intelligence is a very focused and very narrow intelligence. It can only produce or think or tell what you train it to do. So in summary, the convergence of the computing power, which is this we used to call CPU, is now GPU, graphic processing unit, which is highly powerful programming language, and most importantly is the big data. Big data means that all the smart devices that produce the data that are connected with the internet, all their data is fed into the artificial intelligence box or pot, if you will. And the amount of data is huge. Every day, about 2.5 quintillion bytes of data is collected by approximately 19 or more billion devices that are connected to the internet. So what is a smart device? I just used the word smart device. Smart device is device that has memory and is connected to the internet, which means all the cell phones, all the machinery that works on the internet, and all the internet controlled gadgets in the world, including refrigerators, your washing machines, your security system, your military equipment, hardware, software, all that put together is called the smart device. And Internet of Things, just like we talked about, is collects all the data from these devices and processes them real time and can produce answers in a real time manner. And the big data is the data collected by the Internet of Things. Machine learning, these are the two terms that you must remember, because when you read the literature, you will come across machine learning and deep learning. Machine learning and deep learning are the processes by which the computers acquire and process and produce knowledge. So in very simple terms, machine learning deals with the data. That means the numbers. That means you have, for example, number of students, number of examinations, populations, movements, and stock market and businesses and banking, while the deep learning deals with image processing. So it deals with, for example, radiology. It deals with, for example, global positioning. It deals with all those things. So data, numbers, and images, deep learning. Although everything depends upon the data, but the end product of deep learning is actually image related. Now, some other definitions. The Internet of Things has 1 zettabyte of data in it, which is 1 billion terabytes. And the computing power of the computer since 2013 have increased by about 20 million times faster at this time than it was in 2013. And now the data that the artificial intelligence produces is not like one list of things or one Excel spreadsheet. It actually is a multi-dimensional data. And if you notice that this slide demonstrates our data that we do, where we make a graph or maybe even 3D reconstructions of our graphs. But here is the image of the data for artificial intelligence. It's not only, it is multidimensional. It has all directions of data, and any data that is different from each other can be differentiated one from the other. So this is only the two-dimensional representation of multidimensional data. But if you can imagine that it is almost like the universe, and in the universe, all the planets moving around and producing the data. And so that's where the data comes. The other terminology we will use is the natural language processing, and you will make it important, particularly for the deep learning and the machine learning. Natural language processing is important, particularly in the latest GTP. Now, the best example or the commonest example of natural language processing is the Siri on your iPhone. Siri, basically what it does, when you ask it a question, it interprets that question by developing data that is sent to a central computer at the central place of Apple. And that data is processed through the computer, and the answer is found within seconds. And then answer is relayed back to your computer, where it is again interpreted into natural language, so that you're able to understand and receive the answer in a few seconds. And imagine the amount of work that goes behind in just simply answering a question that you ask a Siri. So here is the schema of artificial intelligence. Has really two components: machine learning and deep learning. So artificial intelligence, data science, machine learning is to do with data processing, and deep learning is to do with image processing. So basically what you have: historic data, that means the data from the Internet of Things or big data. Then you subject it to algorithm. Algorithm is basically the set of instructions to the data as to what to do with it. It's almost like a mathematical formula that when you say A plus B is equal to AB, and so on. So those instructions by algorithm is carried out by the computer on the data, and this then data is again fed into predictors or the parameters that will influence the result. For example, pretest probability or incidence, positive predictive value, negative predictive value, accuracy, and all those things. And then it produces a model or the AI system. Now, the model, what is the meaning of the model? The model is something that consists of the steps where from feeding of a question to getting the answer, that is called the model. And the model is produced by the artificial intelligence data scientists in such a way that stepwise processing of your voice into data, then searching the answer, then bringing the data back and converting it into a language in order to answer the question. So that's how the artificial intelligence works. Now, the difference between the traditional programming and computing, that means the computer that we use at our desktop or currently, that you have the input, you input the data, or you ask the computer to calculate a certain, let's say, Excel sheet, or calculate mathematical questions, or ask a question about incidence of a certain disease. That input is rules of interpretations are applied to that rule, and then the programming takes care of the interaction between your input and the rules, and the answer comes out. But in artificial intelligence, you train the computer by inputting the question, and at the same time inputting the answer at the same time. In other words, it's like showing you some new fruit or a new picture that you have not seen before, and saying that this is the picture of a train that runs in Japan and just suddenly or recently became available. So you get shown that picture, for example, you're given the answer, and then next time when you look at that picture, you will know what the answer is. So basically, this is how the artificial intelligence training occurs, so that when the training occurs, then you get the rules, or what you call the algorithms, by virtue of which you can, next time when you're asked a question, you're able to give the answer because you already have the training. So this is how the machine learning, as we said, is process of creating algorithm and statistical models. We just defined the algorithm and model. Algorithm is the set of instructions. Model is a process by which input leads to the output. to improve automatically through experience and use of data to draw inferences. Deep learning, inspired by human neural network, deep learning works through artificial neural network that allows computers to learn and make decisions like humans, such as image recognition and image analysis. So remember, deep learning is similar to neural network, artificial neural network. And the artificial neural network are different for different application. For each application, it's a specific artificial neural network. The interesting part is that one artificial neural network produced for one type of function cannot be used for the other type of function. And one has to produce a new model or new neural network for every step of the function. For example, over here, human eye, here's the human eye, here's the little cat, and the process goes through human neural network or natural neural network, and you know that this is a cat. And you recognize this is a cat because you have in the past stored the memory in your head what a cat looks like. Therefore, if a new object is shown, unless you recognize it, you will not be able to, unless you know what it is, you'll not be able to recognize it next time. Exactly in the same manner, when you go to the literature, you'll find there are the artificial neural networks of this kind, which process the information in order to keep the answer and remember the answer for the future. So one of the commonest indication or commonest application of artificial intelligence in general world is natural language processing. Well, and natural language processing, as I said before, is a machine learning process because it deals with the data, not the images. And therefore, you can actually process chart review and documentation, clinical radiology reports, not the images, and recognize and pick out the processes for valuable information. So natural language processing. And basically what happens in natural language processing, that the data is converted into language and you're able to actually have a conversation with the computer on the basis of which they will answer your question, just like the Siri. The AI GPT, like the second slide I showed you, the most modern application, it really is amazing because you can tell the computer, it's very interesting, you can tell the computer that please write me a 200-page article on treatment, resistant treatment, tuberculosis in between 2010 and 2022. And it will go back into the literature and bring all the data back and actually write an article for you, which will include all the latest and the important data. This is how it functions. And for the researcher, this is a great resource because it not only will bring you all the references of literature, but also will be able to write for you better than many other writers. So a field of speech recognition, as we said, Siri produces, as we said before, your question into answer. Now, here is the text-based machine learning or natural language processing. So, for example, here is the radiology report of a mammography, and the computer has the ability to extract valuable information from a radiology report, understand its meaning behind the words and the phrases, and then collect the data and make it available for whatever reasons, for classifying the disease, the severity of the disease, the location of the disease, the anatomical answer is given. For example, here, the computer was able to recognize the type of tissue, okay, 70% numerical data, location, left breast, upper outer quadrant, okay, type of lesion, microcalcification, what is normal, and what is the grading by RADS4, and what are the recommendations. So you don't, without reading all this, the data is extracted automatically, and all these information can then be used for research purposes, for medical repositories, and so many. The imagination is the limit of what can be done with this data. Now, the image recognition, on the other hand, has also been used in general. So the previous was the machine learning, okay, the data dealt with, like we said before. Now we come to the deep learning. Deep learning is the image interpretation. The self-driving cars or driverless cars use this deep learning is also applicable in, of course, medicine, and we will, next few slides will show you those. But over here is the schema of the field of computer vision, where the camera can recognize each and every item according to its location and what it is. Now imagine that for each item that is being recognized, one has to train the computer separately and put all those two together so that nothing remains unrecognized, so that the driving of the car is safe. So this is really kind of amazing. You couldn't imagine this to happen about 20 years ago. In medicine, for example, here is the mammography that deals with the shape and the density, and the data is collected and interpreted in such a way to see what is healthy tissue and what is abnormal tissue, based on the training of the model and the input. This is how automatic diagnosis of the tissue can occur. That's what made the Dr. Hinton say that the radiologist will no longer be needed. And similarly, you must have read the artificial intelligence applications in the diagnosis of COVID. Several hundred papers came out in diagnosis of COVID in applying artificial intelligence. So this is how it occurs. You train the computer or the program or the model to recognize various images. Now, as radiologists, for us, it's easy to understand that images are digital images and consist of a very large number of dots or pixels, and each pixel has a number because it's digital, and each number represents either color or density, and thus able to recognize as to what the underlying structure is. It's not only the number of the data or the density, but also relationship with the adjacent pixels that leads to more accuracy. And the signs of relationship of one pixel with the surrounding pixel is also called radiomics. You will learn about the word radiomics. Radiomics is the study of relationship of the imaging pixel with each other, because that in itself has a lot of information for interpretation and in medical field. Similarly, once image is produced and the artificial intelligence can be trained, you can in fact take a picture of the retina, and retinopathy can be automatically diagnosed by the pattern of the image it produces. And this is very important, because if you have this program in locations where ophthalmologist or neurologist or anyone who can do fundoscopy are not available, you can actually take a picture of the fundus and use the artificial intelligence to make the diagnosis, diabetic retinopathy or macular degeneration, or whatever the process might be. And similarly, that image has been used image processing, artificial intelligence, and deep learning has been used very widely, still is being used very widely in dermatology, because dermatology is all image of the skin, type of the lesion, distribution, size, etc. And the accuracy of the diagnosis is as high as a senior dermatologist. We also know in radiology, segmentation of images, diagnosis of nodules, characterization of masses and lesions is widely used these days in order to do research to bring it to the mainstream radiology. And we know that the latest sectional imaging machines, CT, MRI, and ultrasound, many of those machines are these days delivered with software already embedded into the machine working. And, for example, computer-assisted detection of lesions in abdomen, in chest, in breast, and bones, etc., that has been around for last good 15 to 20 years. But now the characterization of the lesion between various pathologies is becoming more and more common. Similarly, histopathological slides, again, are images, and they can also be interpreted, and the diagnosis of various histological conditions can be made by the artificial intelligence, deep learning, or neural network programs. Once again, there is such a shortage of histopathologists and pathologists in the world. Did you know that in sub-Saharan Africa, a population of 200 million, there are only 5 pathologists in that part of the world? And imagine that what this program will be able to do if it is made available. And in the places where there are pathologists, the program actually assists those pathologists to increase the workload, to shift more work than before, more accurately and more efficiently, similar to the radiologist, for example. If the machine learning and the deep learning is able to confirm normality of the certain tissues or certain images, for example, chest, to say it's a normal chest, the radiologist does not have to spend a lot of time in going over those. Similar to the computer-assisted detection of lung nodules. We do that, I'm sure everyone does it all the time. You detect the nodules and you just go over it, and it takes about 1/6 or 1/10 of the time compared to if you were to search each and every nodule on a chest CT scan. So it not only, where possible, not replaces, but fills the gap in the physicians and specialist physician, but also enhances the work, speed, and accuracy of the physicians. So as the second slide I showed you, where a robot is carrying a physician with a telescope, it really comes true all the times. Now, robotics is another part of artificial intelligence, and robotic surgery has been around for the last 20 years or so, where the physician will sit on the computer console and operate the robot in order to do surgery. Now, the artificial intelligence robots are now being developed where you will not need a physician sitting at the console and operating the robot. The robot itself is going to do a surgery, especially those surgeries that are repetitive, those surgeries that are almost about the same every time. For example, hip nailing, for example, let's say even a bypass, because the anatomical variations are limited. And especially, you can pre-select those patients that the robot can do, knowing the range of capability of the robot and applying the automatic robotic surgery to those patients. Virtual assistant is another, just like Siri is a virtual verbal assistant or natural language processing assistant. You can have a physical assistant, and this is very useful because these days, these assistants are actually working. We have it in our hospital, where they will carry the specimen or files or valuables from one place to another. For example, you want to send a specimen or specimens to the laboratory, or from wards, or a laboratory from interventional radiology, or from outpatient. Instead of sending a human being, you load it onto the robot and plan and tell the robot where to deliver it. They will go and open the fridge and deliver it, leave it in the fridge, and record the delivery in the computer so that then it can be processed. And another robot will pick up those specimen from the refrigerator or wherever they are and start processing it for the physicians to take the work from then on. So lots and lots of repetitive work, which is done all the time, similar way, can be done by the robotic systems. Now, artificial intelligence, this is my last slide. Artificial intelligence is not a silver bullet. It's not a panacea. It is not an answer to every question, and it's extremely tedious to develop more and more programs on it. However, there is an immense amount of research opportunity available in your own, in your own department and your own specialty, where you can do small projects in order to advance the knowledge in your own environment and in your own country. With that, I'm actually going to leave, give 15 minutes for question so that if there are any question, we can answer. And thank you very much, ladies and gentlemen.
Professor Sarwat Hussain, thank you very much. Really, it was brainstorming and topic of the day. I was looking and reading so many comments about the session. And the session, I will request the people to raise the hand if anybody wants to ask a question, or if anybody wants to give the comments. Please raise the hand so that we can allow them to ask the question. Professor Sarwat, can I ask one question from you, sir?
Yes, sir. Yes, sir.
Okay, this artificial intelligence will replace the radiologists and pathologists?
No, it will not replace radiologist, pathologist. Radiologists and pathologists who learn and who are become familiar with artificial intelligence are going to those who have not learned artificial intelligence. Just like people who cannot use, physicians who cannot use computers, their work is so restricted. And similarly, the artificial intelligence will be in the same place. No, it will not replace. So Dr. Bukhari and my job are still here.
Well, still there. Okay, Professor
We're
Salma
still there.
Kundi, can you give the comment? Professor Salma Kundi?
Yes, thank you so much. I'm so sorry. There's something wrong with my cell phone. Probably you couldn't hear me from there. Or if you could, I couldn't hear you. So I've taken my husband's phone. Thank you so much, Professor Dr. Sarwat Hussain. It was really magic, whatever you told us. And I want to make a brief introduction of Dr. Saab. Hello, can you hear me?
Yes, we can.
We are hearing.
There's something wrong here. So I'll switch to my own phone. Can you hear me now?
Yes, we are hearing, madam.
Okay, sir. The brief introduction of Professor Sarwat Hussain Saab is that he is a remarkable person who's been a registrar at the University of London, founding chairman of our University, has been associate visiting professor at Harvard University of Medical School, and the vice chairman of Boston University of Medical School, vice chairman of University of Massachusetts, and he has been the chairman of King Faisal Specialist Hospital and Research Center and King Saud University. There's so many things under his belt. Mashallah, he's the editor-in-chief of the Journal of Global Radiology. And at the moment, he's radiologist at Richmond Medical Center and professor of radiology at University of Massachusetts and at Virginia Commonwealth Universities. Mashallah. We are really, really honored to have you today at this session, and it was a joy listening to you, sir. And I thank all the participants who are here today. And I think that General Aslam had raised his hand. He wants to ask something. I'll take over from there later. Thank you so much, Professor Aslam. To you.
Thank you. Thank you very much.
Dr. Zahoor, you can ask the question. Dr. Zahoor, a question is, sir, how can a resident with basic knowledge of coding get into artificial intelligence to develop simple model or optimizing work at the ER?
Yes, sir. So basically, I think what we should do, I think what the beginners, what beginners can do is to, I think somebody's phone is good. So what beginners really can do is to just start with the use of computer in facilitating and making more efficient workflow, and that will be counted as artificial intelligence, because you don't need, just use the computer from manual to computer. Every time you're able to change a process from manual to computing and show improvement, that will be a paper in artificial intelligence. Because artificial intelligence basically is sometimes a very frightening word that can stop you from thinking small. You know, sometimes you have to think small in order to reach big things. So you just use your computer to improve the workflow or accuracy or something. Anything like that. For example, you can say that the flow of patient into the department and the waiting time has been reduced by the use of a computer where the patients were prioritized according to the according to the severity of disease. Or you can say, okay, instead of giving critical result from pathology to the physicians, undiagnosed cancer or unsuspected cancer has been diagnosed. Instead of us trying to phone call the doctor, we came to an arrangement where we texted the doctor and received the answer within 2 minutes, instead of making a phone call by finding the doctor and spending 15 minutes. We saved 13 minutes and communicated the result accurately. And here is the use of the artificial intelligence in improving the communication and saving time, for example, right? So that can be the a paper, for example, or we came up with a a process by which we got a little lens in the microscope to send the image of biopsy specimen to the pathologist through iPhone attached to the microscope, in order for them to give us the result, whether we have the tumor in the specimen or not, instead of them coming down and waiting for us to get the specimen and analyzing it, et cetera, et cetera. So it saves time. And here is a paper, for example.
Yep.
Or you can say list of emergency physician have a certain way of tagging the patient based on priority, so that you can read those cases before the less priority patient. Because in emergency, there are all kinds of severity of patients. There are certain patients who require immediate attention, others do not. So if there is a way for emergency physician to tag their request, telling the radiologist, this is priority 1, this is 2, this is 3, it can facilitate patient care. And here is a paper, for example. So, there are many, many small little steps. One small addition to the knowledge or efficiency or accuracy is a research paper.
Thank you, Dr. Sarwat. Dr. Nigat Nadeem, you can ask the question. Dr. Nigat Nadeem. Dr. Nigat.
Ji, I'm here. Assalamualaikum. Sir, I would like to ask, what role and how much should AI play in undergrad medical curriculum? And secondly, what is the best rationale to make people understand that AI is not replacing their physician, pathologist, or any other doctors? Thank you. And thank you.
I'm sorry, I forgot. I didn't hear the last question. What is the best evidence of?
What's the best rationale that we can offer people to understand that AI is not replacing the physicians, pathologists, or any other doctors?
Right. Okay, the best, first of all, the curriculum. In fact, I wrote a chapter on artificial intelligence in medical education, and that includes the the curriculum part also. Basically, artificial intelligence can in fact customize the curriculum based on the individual learning ability of a students, based on their performance in the through the education. That's one small advantage of artificial intelligence in the curriculum. Also, they can include in the curriculum the information collected through the natural language processing, as well as the curriculum development can become almost like automatic by looking at the disease pattern for which the students need to learn. Every society has their own disease pattern. For example, let me give you an example, doctor, that when we were medical students, we used to learn about port wine nevi, right? Port wine nevi in, now, port wine, Levi, what is port wine? How many students know what the port wine is? Port wine actually is a red alcohol that I did not really know until I went to England and heard about port wine. And you know, there's so many words that we use, that we learn, that we don't know what they mean, and they don't know what they look like. But so the artificial intelligence in the, not only in the curriculum, but also in the medical literature, can update the knowledge based on what is you are familiar with, so that eventually we will be able to produce our own textbooks instead of reading, you know, Price and whoever else, who write those based on their disease pattern and their society and their familiarities. We need to do that for ourselves. The argument about not replacement is show them that if they learn about artificial intelligence, their work will be more efficient, they'll be more accurate, and they will earn more money, and they'll have more respect, more research, and they will automatically
Definitely. Dr.
Thank you
Aslam
very
Saab,
much.
Dr. Aslam Saab.
Thank you very much, sir. Thank you very much. Dr.
Professor
Sarwat.
Aslam Saab was the Vice Chancellor of, ex-Vice Chancellor of UHS. Professor
Yeah, I
General
know, I know.
Aslam Saab, sir.
Thank you very much, Dr. Hussain, for making us aware about the basic concept of artificial intelligence in healthcare systems. My question is very simple, that if there is a difference of opinion in diagnostic imaging or histopathology with the artificial intelligence and with human native natural intelligence, is there any mechanism to resolve this difference of opinion in diagnosis?
Really interesting question, sir.
Sir, first of all, I'm honored that General Aslam Sahab is here. I had the honor to meet with him at a lecture at NUMS on quality, healthcare quality. He was very gracious. Thank you, sir, very much.
Thank you very much, sir. Thank you very much.
Sir, the answer is, and I think it's
because you both were selected the Vice Chancellor, you were selected the Vice Chancellor of the KE, but you don't joined, and Dr. Aslam joined as a Vice Chancellor of the UHS.
No, I was not selected. I was in the merit list, but not selected.
Okay.
No. Professor Aslam is a much better candidate than myself. So, so basically, sir, you know, difference of opinion, it really depends on the skill of the live human intelligence, because it has been shown that artificial intelligence in, for example, mammography has been as good as in consultant radiologist. In pathology, they are as good as they say 5 pathologists giving their opinion. So it really depends upon how experienced a certain pathologist is. However, at the end of the day, the legal responsibility, which is also another big topic, lies on the live radiologist or pathologist, because if a mistake is made, you cannot send a computer to prison.
That's right. Thank you very much. Thank you indeed.
Thank you very much. Professor Tanveer Zubairi. Professor Tanveer Zubairi.
Assalamu alaikum. Mr. Sarwat. I'm so amazed, really excited to listen to the talk. And you never cease to surprise us with the kind of knowledge Allah subhanahu wa ta'ala has given to you, and your quest to spread it all over. I just have a little question that how much surveillance will be required in execution, in like security and other aspects, including inaccuracies and of course the legal aspects, and physicians or the doctors, they have to buy. In West, while they're working in US, the company the insurance for malpractice insurance and other stuff. So these all areas are will require some human surveillance. So how do you see?
Sir, can somebody summarize the question, because there was a lot of echo. I could not understand the question.
Dr. Zubair Tanviri, your voice was vibrating and we could not understand your question. Can you chat it? Can you write in the chatting?
Can I just like summarize it?
Sir, actually, I think if you take your computer away from you, it'll be, because there is too much echo. I could not understand. I'm sorry.
Okay, Dr. Ashar Wasim. Dr. Ashar Wasim.
Assalamu alaikum, sir. Thank you very much, Dr. Sarwat, for a wonderful session. Special salam to Dr. Mulazim Hussain Bukhari. I've been a student at University of Lahore. Sir, I just wanted to request for, I was also doing research on this AI, role of AI in diagnosis of oral and maxillary pathologies. I just want to just request all the participants to kindly, I've shown some Google form in my chat, so kindly, if
Definitely.
Chat, please fill this form. So, and thank you, Dr. Sarwat, for a wonderful session. And thank you, Dr. Mulazim Hussain Bukhari. Thank you very much.
Dr. Professor Ghulam Sarwar Pirkani from Balochistan. Professor Ghulam Sarwar Pirkani from Balochistan. He is a pathologist.
Assalamu alaikum. Sir, can you listen me?
Yes, sir. We are listening you.
Okay, thank you, sir. I'm privileged that I'm sitting here in Balochistan and learning some from a teacher from USA and a teacher of so many universities. So, but I think it is now becoming part of IT must be a part of undergraduate and postgraduate education.
Definitely.
Because we know that without access to the IT, without access to the computer, now our teacher, our doctor cannot compete with the others, those who have the knowledge or who has the computer or access to the net. Because I have learned at the end of my this serving age that the HIMS running is a hospital is likely very different from a simple hospital which we worked before. So I think this IT is now becoming part of undergraduate also curriculum. Otherwise, the students cannot cope with the modern age facilities.
Professor Sarwar, can I answer this question?
Yes,
Yeah,
sir.
you
Yes,
can.
sir.
Okay, today is the meeting of CPSP Pakistan in Muzaffarabad. I am part of there, but I am here only to attend this session. And it is the good news that CPSP Karachi is starting a fellowship in artificial intelligence and robotic surgery. I hope without this, your pinpoint question was very important, that without this, we cannot go forward unless we start this program. Dr. Sarwat, can you comment more?
Sir, absolutely. I think it's about time that we bring this into a formal curriculum. Yeah, that's a great news, and I will be happy to be part of the faculty if they allow me in the course or the teaching.
Definitely, I will convey your message to the president. CPSP is just sitting with me. Dr. Amna, you have raised the question. Dr. Amna. Dr. Amna.
Okay. Sir, assalamu alaikum. First of
Walaikum
all, my salam to Sarwat Bhai. It was an excellent presentation. I would say,
Dr. Amna.
Professor Amna Yusuf.
How are you, madam?
yes, it's me, Musa, my son, logged in, and I followed later on. And
how are you feeling? Your health is
I'm
good now?
Sir, I'm much better, alhamdulillah, by the grace of God and by your prayers. I've become a stent woman. I've got 3 stents now, and I'm back to normal, alhamdulillah. So it was, an eye-opener, because I've been hearing about artificial intelligence and machine learning, But over here, we don't get the being an obstetrician, we're too busy to indulge into these things. Sir, I really wanted to know what would be the role in obstetrics and gynecology. Gynecology, I understand, like you said, like robotic surgery or surgeries which are being done again and again. But what about obstetrics? Once I heard that artificial intelligence will not be able to replace an obstetrician, others might be replaced. But today I'm very happy that you've said that everybody is going to be on job. It's not that they're going to be replaced, but
Yeah.
things are going to be improved. And special thanks to Professor Mulazim Bukhari. He has arranged an excellent session. I'm sure every one of us has benefited from this. So,
Thank
sir,
you,
over to
Professor.
you, please.
Sir,
Thank you,
madam,
Professor.
you know, as you know, that obstetrics is not obstetrics is a very wide term, wide specialty, and the ultrasound evaluation of the fetus there are software programs that I know have become automated, so that the software program itself will find the structure, measure the structure, the BPD, and the lengths of the various limbs, and interpret more accurately than calculation that we do, and thus able to prepare the obstetrician with the possible complications, not only of the fetus, but also of the mother in terms of placenta, in terms of, entering the patient's data of hematology and blood pressure and all that, and calculate the risk to the mother and the child in order to pre-warn and prepare the obstetrician for for the consequences and take care of the complication before they occur. So tremendous. You see, remember that in artificial intelligence not only supports the function and thinking of the physician, but remember that physician's work is supported by other huge number of factors, which are data, which are medical record, which is laboratory, which is patient's condition. In addition, for the physician to go over all the previous and the new laboratories and history and all that stuff, it takes, I don't know, 2 hours, 3 hours, 4 hours. But if that data is available in the computer, you can press one button and it'll give you the trend of, let's say, blood pressure or blood parameters or hemoglobin, or so many things that it will give you instant ability to make a more accurate decision and document it.
Thank you. Thank you. Last question. Professor Dr. Sajid Iqbal, the last question. Dr. Sajid Iqbal.
अस्सलाम वालेकुम, सबको सलाम। अच्छा, थोड़ा सा मैं अपना इंट्रोडक्शन करा दूं। आई एम अ कंप्यूटर साइंटिस्ट और मेरा जो रिसर्च डोमेन है वो बेसिकली यही है कि मेडिकल इमेजेस को यूज़ करके किस तरह से हम डायग्नोसिस कर सकते हैं, मुख्तलिफ इंटरेस्टिंग पैटर्न्स, इंफॉर्मेशन, डिजीज डिटेक्शन, ये सारी चीज़ें हम किस तरह से कर सकते हैं। इस चीज़ पे मेरा कुछ काम है, कुछ पेपर्स में पब्लिश कर चुका हूँ। मेरा क्वेश्चन ये है डॉक्टर साहब आपसे कि पाकिस्तान की जो मेडिकल हमारी कम्युनिटी है वो मेडिकल डेटा शेयर करते हुए बहुत ज़्यादा घबराती है, और जब तक मेडिकल सोसाइटी, क्योंकि जिस चीज़ पे आप बात करें दैट इज इंटरडिसिप्लिनरी काइंड ऑफ वर्क, अगर मेडिकल सोसाइटी ओपन नहीं होती है डेटा शेयर करने के लिए, इंफॉर्मेशन शेयर करने के लिए या रिसर्च में पार्टिसिपेट करने के लिए, तो फिर किस तरह से ये काम हो सकेगा?
Right. Sir, I think this should be solved through legislature, and the legislation should be such that they have to share the data, especially if the patient requires it. The data belongs to, well, it does not belong to, but the patient has a right over their data. And if they want a second opinion, or if they want their data to be shared by a physician who's been who they want to go and see or who they want to be referred to, then legally it should be mandated. There is no other way, because the human nature is human nature. And if there are consequences of not sharing the data in terms of legality, then you will be forced to share the data.
Professor Nausheen Yusuf, can you want to ask something? Doctor?
Assalamu alaikum. It was obviously a phenomenal lecture. I really enjoyed, although it was a bit difficult for people of my age. Just a very simple question, Dr. Sab, that I'm a histopathologist and I'm used to, I have a knowledge about like IBEX system, which is used in prostate core biopsies for artificial intelligence for picking up the cancerous foci. But my question is that how much is the sensitivity and specificity of all these results? How much can we trust? Like with people of my age, there are things ingrained in our mind that this is the morphology that I have to pick up for calling it a cancerous area. But when it comes to an automatic reply to me that, okay, this is malignant focus, how much is the sensitivity and specificity that I'm confident in accepting?
Very, very intelligent question, Dr. Saiba. First of all, you said your age. I'm not going to ask your age because it's not.
Thank you for that.
Madam,
thank you for
Madam,
that.
You are always our genius teacher.
So, Madam, the question really is the program is as good as it is trained, just like people are as good as they're trained. So if you have trained that program, for example, and you will, by training the program, I mean, you will show the program, the computer program or the artificial intelligence program, what you consider to be malignant and you consider to be benign, it will learn that. If, for example, somebody trains the computer that themselves are not well trained, then the answer of the artificial intelligence will be as inaccurate as the person who trained it. So that's number one. Number two, the limitation of artificial intelligence is also that if they are trained, if they, for example, trained by in your department where you have a certain way of staining and developing the slides, it may not accurately perform at the same accuracy in another department where they have a slightly different way of staining the slides and presenting the slides. So, you know, it is, I give you an example with tongue in cheek. It's like an angel, a farishta. A farishta said, you know, Allah, we only know what you told us. And you are the all-knowing. So artificial intelligence only know what it is trained on.
Adam told everything, sir.
Right, that's exactly right. So that's where the difference is.
Yes,
that artificial intelligence is like a farishta. They only know what they have been told. If you have trained them with your satisfaction and your accuracy, then they can reproduce almost what your accuracy is. If I train them,
last question, sir.
If I train them as a radiologist and I train them in histopathology, then they will be more often wrong than not. So that's the fundamental of the artificial intelligence.
Over to Professor Salma Kundi to conclude. Thank you so much, sir. Over to Salma Kundi.
Can you hear me?
Yes.
That was a great talk, and I thank you, Professor Sarwat Saab. We really enjoyed it and hope you have a blessed Sunday. And I thank all the participants, and special thank to Mulazim Saab for arranging this beautiful webinar. Thank you, General Aslam Saab. Thank you, Pir Khani Saab. Thanks everyone over here. Have a blessed day.
I just want to tell anybody, I just want to tell everybody that whoever wants to get in touch with me directly, please go through Dr. Mulazim Hussain, who has my email address, And I will be, inshallah, able to answer all questions in due course, in due time. Thank you very much
Thank you,
again.
Dr. Sarwat. Thank you. Stay
Allah
blessed.
Hafiz.
Allah Hafiz.
Allah Hafiz.
Allah Hafiz, Mulazim Saab.